Talk about a clearer future for cataract patients. Hartford Hospital rolling out light adjustable lenses, and patients are seeing the future clearly, and they are loving the results. Joining us this morning, Dr. Alan Solinsky, board certified ophthalmologist at Hartford Hospital Eye Surgery Center. Doctor, first of all, thank you so much for your time today. It's great to have you.
Great to be here. Thanks for having me.
Yeah, it's a really important topic. It impacts so many people. So to start, why don't you tell us a little bit more about this light adjustable lenses we're talking about for cataract patients, for those people who may not be familiar?
Sure. So first of all, a lens implant's put in the eye whenever we do cataract surgery. The standard lens implant is a fixed lens implant. We calculate in the office what the person should get, and we put it in the eye, and we're usually very close to being spot on, but sometimes we're off by a little bit, so a person has to wear contacts or glasses more often than not. With the light adjustable lens, we do all those calculations in the office, then we do the operation, and then we let the eye heal for about 3 weeks. And at that point, the magic starts. We use the light adjustable lens delivery device to sculpt the lens in the office, actually. We just refine the lens implant so that a person could see as well as possible without glasses.
Wow, that is really impressive technology. So for people who have had this done, how are patients reacting to the new option?
Yeah, patients are reacting very well. There's actually two categories of patients, the way I see it. One is patients with abnormal eyes who want to invest the time and the extra money to get this lens implant to have the freedom of not going with glasses most of the time. And they're very, very happy with that result. They go on the journey with us. 2 months later, they're doing great. They have it for the rest of their life. The other category is patients with really difficult eyes, very hypermature cataracts that you can't see through, people who have radial keratotomy or LASIK before, and people who have had just corneal dystrophies. Those patients benefit from it because um, get we're able to adjust the lens after we put it in. So we don't have to do lens exchanges or touch-ups
Hmm.
afterwards. We get it right the first time.
Wow, that's good. You know, you talk about time is money, right? So that's really important when you're talking
Yep,
about extra follow-ups after the surgery. So this really
right.
helps patients through that process and minimizes things?
Well, we do the surgery. We let the eye heal for about
Mm-hmm.
3 weeks afterwards. During that time, the patient's still seeing very well.
Okay.
They have to use some UV light protection goggles over their eyes to prevent the UV light coming in from the sun. And then, like I said, the magic begins after about 3 weeks.
Yeah.
We use the light delivery device to customize the lens, and the patient could test drive it at home, say they want a little better distance, a little better for the computer, a little bit better up close. They're in charge, and we deliver the results for them.
And how about in the long run? Are we seeing these results lasting longer, long term for your patients?
Yes, patients basically are doubling their chances of getting to 2020, or if their retina allows them to get to 2015. So it's doubling your chances of seeing very, very well for both the short term and the long term as well.
Wow, that makes a big difference on your life, Doctor. I think that's
Sure
great.
does.
Hey, thank you
Yep.
so much for your time today. Dr. Alan Solinsky joining us with this wonderful news. It's great to hear from you today. Thank you for your time.
Good. Thanks a lot. Bye.